thank you all for joining us today. So please introduce yourself, tell us what your experience was getting the COVID-19 vaccine, and tell us how long you've been practicing medicine.
I am Dr. Brown, and I'm actually a pediatric nurse practitioner, and I received my nursing doctorate in 2015. I've been practicing in primary care pediatrics for 22 years now, and most of my practice has been in the school-based health clinics. I received both doses of the Moderna vaccine. I completed the second dose last weekend. I was glad that I received the vaccine. I think that it was a step in the right direction as a healthcare provider and as a person who cares for my elderly mother. It made me feel a little bit more comfortable that I can kind of be safe, feel a little bit more safe in my interaction around actually my patients as well as my mother. And I think with all of the morbidity and mortality that we're seeing with this pandemic, I feel very confident that we will put this behind us. So I did fine. I had minimal side effects. I did have some flu-like symptoms, but other than that, I'm glad I did it.
Hello, everyone. My name is Dr. Curtis Johnson, and I'm a graduate of the College of Medicine and Dentistry of New Jersey in 1979. And I've been practicing medicine, pediatric medicine, for the last 42 years. I was fortunate enough by Dr. Kim Kelly Robinson to be rescued from my retirement after moving down into the Washington, D.C. area to be able to once again have the privilege of being able to take care of children who are our most precious resource. I received my second Moderna vaccination at the end of last month. And it was a little bit more taxing because based upon what I've been able to read, it may be a 50-50 split as to whether or not those who have actually had COVID-19 would have a more intense or brisk reaction to the vaccine. But in terms of the reactions itself, headache, muscle aches, lethargy, and tiredness, all of which resolved over the course of 48 hours. So if the question is to be asked whether or not I would do it again, or is the risk worth the benefit, absolutely.
Thank you, Dr. Johnson. Dr. Kelly?
I've been in practice for close to 30 years, even though I'm only 28. And I've been practicing here in the Washington, D.C. and Maryland area. I started the practice here in 2011. And we've grown from a solo practice to having two nurse practitioners and Dr. Curtis Johnson with us. We all enjoy working and interacting with our little angels. And remember they're all angels in my eyes. I received my second Moderna shot early February. And I did have a slight fever the next day, but I continued to work. I was a little sluggish the second day, so I had the aches and pains and a little bit of lethargy. And by the third and fourth day, I was back. I was my usual self, feeling normal. When I took the first Moderna injection, it was a sense of relief that came over me. I've heard some people cry. I almost cried. It was such a relief to know that I was taking part in solving the problem of the pandemic so that I would not be a big spreader of the COVID to my family, my mother, as well as the patients that we serve.
Thank you all. So let's jump right in. I know that schools are planning to reopen soon at the time that we're recording this. So the first question that I received from a parent is, if there is no vaccine for children under 16, why is it safe for children to go back to school? The spread of the new variants is alarming. Children are still getting sick and some are dying. when would be the ideal time for students to safely go back to school, summer camp, etc.?
Basically, we're dealing with what comes down to new science. And to answer those questions is not necessarily still up in the air, but is morphing, at least right now, on a daily basis. But you have to take into effect the fact that there are concerns about the health of the children, and by children we mean from pre-K all the way up to high school graduating. But there are also concerns for their teachers. And when that comes an issue, then we're talking about the concerns of teachers' unions. We're talking about the availability of vaccinations for older children in the 16 to 18 age range. We're talking about availability of vaccines for teachers. So I really think that that's a question that can only be answered in the spectrum of the political malaise that we're in now. However, even after having said that, the way things are looking right now in terms of how, what I think wonderfully well the rollout so far has been in terms of vaccinating adults, that we could be looking forwards to September as being a time where there might be enough quote unquote herd immunity and enough of the population who have been either infected or symptomatically infected or vaccinated, whereby it would be safer to do, using somewhat like influenza as a model, although that may not be too exact an analogy.
As Dr. Johnson was saying, I mean, we really don't fully understand the role of the children in transmission, but what I have seen is that there has been few outbreaks in the schools among children. I mean, we have even just talking to friends who have had kids in school since the pandemic started. They're either hybrid or they are full-time, and there hasn't been any problem. I think the important thing is that schools have now had enough time to kind of get things in place. You also have to follow kind of what's going on in the community. They are doing contact tracing. They want to make sure that they have things in place like for testing. Parents also have to be, vigilant on making sure, like if your child is sick, do not send your child to school. I think it's important to look at some of the things that they have in place, what the school is going to do. Regardless, the kids are going to have to wear a mask. They're going to have to continue to social distance, wash their hands. That's, we're going to be doing this for a while. But as far as each school district is different, because you do have to look at what's going on in the community. So just because your county doesn't open up but somebody else's, it just depends on what's going on in that area. But I feel that the kids do need to get back in school, but do it safely. And again, I don't really think we have enough information yet, because kids haven't been in school. So it's really not a way to really, we don't have enough data.
Yes, I would agree with both of you. It's important for us to emphasize that the protections and the safety precautions, the mask wearing, that the schools continue to reinforce this, and the 6 feet distance apart, the partitions around the desks. They now have the ability to spread the children out a little bit more, and they know the right type of safety precautions to take. Part of that question was the safety of the children as well. I wanted to touch on that. Children can get COVID-19, and a majority of them have a very mild symptoms, if any symptoms at all. They may have a slight fever, runny nose. The chance of a child dying from COVID-19 is extremely small compared to the elderly or the senior population in our community. So that portion should not be as worrisome, as long as we're doing the tracking and testing properly. Then we know to watch and observe the child that's COVID positive after they return back to school, and over the next few months to beyond to the point where they will have those consequences. The MIS-C is something where their blood vessels get inflamed. That's very, very rare in children. But now pediatricians and nurse practitioners and other physicians, we know now what to look for, and the signs and symptoms are have been studied a little bit more, so that we're now acutely aware of what to look for if a child does become COVID positive and the consequences or the sequelae of that infection later on.
All right, so our next question, as you know, many of our patients have various environmental allergies, food allergies, deal with things like eczema or asthma. And so parents, a common question we've been getting is the vaccine safe for the teens who have, these allergies, or children with severe allergies, peanut allergies, environmental allergies? And if it is safe, which one do you think is better, Moderna or Pfizer?
Based on the clinical trials with both of the Pfizer and the Moderna, there has been no severe allergic reactions, whether it be somebody who has allergies to food, medications, environmental allergies. A lot of people ask about the peanut allergies, like you were saying, even your, other reactions that they've had. I think the Moderna, there was maybe 2 people who had an allergic reaction, but that was like, I want to say like a few months after they had received the vaccine. So they don't think that was contributed to the vaccine itself. And, we don't also know the underlying conditions of these patients. They didn't really specify. But with any type of reaction, if you've had a previous reaction to a severe reaction to vaccines in the past, no, it is not recommended. You're going to get, as we mentioned, some slight side effects. But other than that, I think it is safe, to receive the vaccines. And, you have to understand you are monitored. So with anybody, you're monitored for at least 15 minutes after you receive your vaccine, both doses. And if you've had reactions, or I should say not reactions, but if you've had allergies to medications, food, or environment, it is recommended that you be evaluated for 30 minutes after you receive the vaccine.
I think in a word, to answer the question, yes, it is extremely safe to be able to have the vaccines administered to you. I mean, the numbers that have been produced, I mean, when you realize that worldwide, the total number of doses that have been administered is in the hundreds of millions right now, and that from a statistical standpoint, the numbers per million of reactions and severe reactions has really been minuscule. I think one of the best examples I found, not to sound a little bit askew, but you stand a better chance of having what's called a toilet reaction than you do having a reaction to your vaccination, i.e. I sat on it for too long and developed numbness in my legs, by a factor of hundreds more so than that. So to answer the question, yes, it is safe. But again, to go with what Dr. Brown was saying, there are those who have sensitivities to portions of the vaccine, such as preservatives or other chemicals within it that may provide for the vaccine safety that you can be sensitive to. And of course, if you've had a quote unquote vaccine reaction in the past, the waiting period wherein you'd be asked to sit around and be monitored for any reaction is key. And I think that once it was realized that there is a certain subset of patients who will have that happen, that the monitoring has been most key in making sure that the numbers are accurate, and that for those people who do have that type of reaction, as rare, very rare as it is, that they get immediate help.
Most of the facilities also have equipment and oxygen there available if there is a sudden reaction or immediate reaction within the first 15 minutes. They also recommend that you bring your EpiPen so that you'll have it if needed for the 15 to 30 minutes after the vaccine. We need to remember that the vaccines only have 5 to 10 components. It's very, very minimal. Of course, there's no egg in it. There is no peanut in it. And so the chance of a reaction to certain foods is reduced significantly because of the way it's made. So there's salts and a little sugar and a little bit of the protein and a little bit of fat. That's all that's in the vaccine pretty much. So there's only a few components that you can react to. But some people are hypersensitive, and that's why they recommend bringing the EpiPen, and that's why we observe you for the 15 minutes.
All right, so the next question I have, so if my child has been recently ill or if they're immunocompromised, is it safe for them to receive the vaccine?
So if your child has been ill, we do like for them to have fully recovered from that illness, virus, flu, before we give the vaccine. That's why they ask if you've had a fever, if you've had any symptoms before they give you the vaccine. They are recommending that you talk to if you're on immunosuppressant medicines like Humira or one of the injection medicines for arthritis, eczema, Crohn's, GI problems, then speak to your specialist first to make sure it's okay. Most of them are agreeing that the benefits outweigh the risk of you getting the vaccine. The question mark, because this is a new vaccine, new disease and everything, the question mark that's still hanging over us is how good of a response people who are on immunosuppressant medications, if they're able to mount the full response or not to the vaccine. But even if you're only able to mount a partial response, that's better than a zero response. So we're recommending that you check with your specialist if you go to a rheumatologist or a special GI doctor who has you on the medicines that you inject every week or every month, that you check with them first before moving forward with the vaccine.
And I guess just to add to that, I mean, those who are immunocompromised or have, one of the common illnesses we see is asthma. That's why it would be important for, since children right now, it's, not approved yet for the young kids, but that would make it more meaningful for the adult in the household to get vaccinated so you can protect those who are immunocompromised.
All right. For the next question, it says, my family and I don't go anywhere and have not been sick. Why should we still get the vaccine?
I think that in terms of community health, that the term herd immunity has been bandied about by a whole host of people. The concept of having a certain percentage of your population be immune either based upon prior infection or immunization, and how those numbers cut down on the transmissibility of the virus is key in terms of modifying transmission. But the best way that I like to think about it is taking care of your neighbor's health also. I mean, we wear masks and PPE not only to protect us from becoming infected by others, but also just in case we are the ones who are clinically stable and have no symptoms, but are still carriers of the virus for a period of time to keep us from infecting others. So the fact that you don't go out means that when the Uber driver drops off your dinner at the house, and if they're not wearing a mask and they're not wearing gloves, and you pick up that box and come into your house and don't wash your hands, that you are at risk for transmission. So to follow through with risk modifying and mitigating behaviors is key to helping get an end to this. So yeah, that even though you don't go out, it is still very important that you maintain preventive measures to help prevent transmission, either from you to others or others to you.
And we want to start going out. So that's what I say.
Right.
When people say, they don't go anywhere, I'm like, okay, well, you're right. I'm not going, too many places either, but we want to start, so it's a step in the right direction. I don't want to be in this, forever. So I'm definitely on board.
All right. So another concern I've heard is that there have been multiple people who have died shortly after receiving the vaccine. And so how can we still say it's safe? Is there a connection between the vaccine causing these deaths? How can we reassure the patients?
A few people that I've heard that have died after receiving the vaccine were mature in age, and we don't know their full medical background history. They may have had underlying health problems, which may have caused them to pass with or without the vaccine. So I don't think there has been proven a correlation with someone taking the vaccine and then dying a few days later. The famous one is the baseball player. And nobody knows about his past medical history to say for sure it was because of the vaccine.
And then what about the new variants? Are the vaccines going to protect us against these variants?
I don't think we know that. I just think that, this is all new. The new variants are coming up. So we have to understand that the clinical trials were based on the actual COVID-19 virus. And now we're seeing the new variants pop up. So I think it's, safe to say that we just still need a little bit more data regarding the new variants that are popping up, because the clinical trials were already done before these new variants started popping up.
What I'd like to add also is that once we reach the herd immunity, the frequency and the number of variants will go down, because your body will not make the variant to pass on to your neighbor or to your family member, who will then pass it on to someone else before it even jumps across any oceans. So it's important for everyone to think of not only themselves, but the community, and get the vaccine so that the number and frequency of variants that we will see over time will decrease and the vaccine will continue to be effective.
I think in looking at some of the statistics that have come out recently, as recently as the end of January, to name names, the J&J vaccine is up on the market supposedly is 72% effective against the original COVID-19 virus, but has demonstrated itself to be only 57% effective against the South African strain. Novavax is 89% effective, but only 50% effective against the South African strain. What people need to realize, again, from a purely statistical standpoint, is that having 50% immunity is way above the safety margin of having zero immunity. And again, going back to, it's not an accurate analogy, but it's an apt analogy. The flu vaccine, which in any good year will give you maybe maximally 60 to 70% effectiveness, is an effective tool in mitigating infection. So even with that, right now, it is still an excellent idea to go ahead and, for the sake of herd immunity and the sake of your own protection, to go ahead and be vaccinated anyway, even if the percentage of protection is less than it would be otherwise. It's still a great idea. And again, maybe a question in the future of how to get around vaccine hesitancy, but to make sure that we let our patients know that, again, even if the numbers are diminished with variation, that is a safer route to go than not being vaccinated.
Okay, so as we can see, the Moderna and Pfizer vaccine is 94% effective, which is great for the original COVID-19. It is also still effective against the variants. The next one is Johnson and Johnson, which is 74% effective.
72%.
72% effective. So as Dr. Johnson said, 72% protection is better than 0% protection. So it's important for us to take whatever vaccine is available at the time so that we can have some protection.
And Johnson & Johnson has also stated that it was actually 85% effective at preventing severe illness, so people who are in the hospitalized on oxygen. So that's still pretty good numbers. And you all mentioned a lot about herd immunity. So how can herd immunity in the pandemic?
So the way herd immunity works is if one person has COVID and they're making hundreds of thousands of virus or COVID virons, and they are sharing them with everyone around them, then it is like a chain reaction from one person infecting many. When we have herd immunity, and some of us have been protected with the vaccine, if someone is sick amongst us, when they share the virus to the community, there's a significantly 90% chance that I won't get sick, and it's a significantly reduced rate of me sharing more of the hundreds of thousands of virons to maybe 20, 25 other people that I come in contact with. And so it kind of breaks the chain reaction of one person giving it to 5 people, those 5 people giving it to 25 people, and so forth. And that's why when we have 60 to 70% of individuals who have received the vaccine, therefore they're not spreaders, or their chance of spreading it has reduced significantly, then the one person who has never seen the germ at all is less likely to get sick as well. And so when the herd, or the large number of us, has been vaccinated, it protects that 1, 2, or however many people in your community that has not had the infection. It protects them as well. But it takes most of us, if not all of us, to stand up and say, yes, I'm willing to take the vaccine to protect myself, my family, and my community.
It's good stewardship for your community to be able to say that we were vaccinated and we helped our neighbors across the street and down the street not become sick and die. And again, this is the ultimate reason why we vaccinate in the first place, to help break, as Dr. Kelly Robinson said, to break that chain. Because the question now or to be asked is whether or not, okay, we're vaccinated against COVID. Do we have to do this once in our life, every year? And again, the new science that it is, these things will be borne out over time. But for right now, whether or not the current downward trend in total number of cases and hospitalizations is because of vaccination, I would like to believe so, that that's a major part. But that in combination with the fact that people are becoming much more in tune to using those methods of blocking transmission, such as hand washing and mask wearing, that I hold out really good hope for the near future. This year, the total number of cases of influenza have gone down dramatically, if for no other reason to prove that respiratorily borne viruses can be mitigated by simple things such as hand washing and mask wearing.
All right, thank you all for joining us today. So we'll close it out there. If you all have any other questions to our patients, you can always ask at your next visit, or feel free to message us on the patient portal.
I'd like to say one more thing, and to thank Ms. Kenya Colvin for her diligent work and efforts to bring this to the public, and we're all very, very grateful. Thank you very much.
Thank you.
Yes.
Yes.
Thank you so much.
All right, thank you, everybody.
Bye.
Bye-bye.
Bye.